This is the Smoke Break Therapy Podcast. The show where Mark sits down with the fam to discuss important topics while getting super deep to Pass the J.
4, 3, 2, 1, 0. All engine running. Liftoff. We have a liftoff.
All right, Rob. I brought you here for a very specific reason.
You brought me here for many reasons.
I need to bring it up to you now. I need to hear your history of adult dental care and give it to me.
Oh, boy. It all started...
It all started when my mother was born.
Yeah.
Just kidding.
Started when my mother was born. She became a dentist. Ruined my life.
What?
No. I'm going to give you the history, the lowdown. As someone who struggles with the routine of brushing their teeth every day.
Oh.
Because ADHD is the worst. We all know that.
You struggle with... Wait. Do you struggle with brushing it once a day? Or
Yeah, once a day. I'm okay with
How?
myself if I can do it once a day.
I don't mean this offensively, but how?
I can't even fathom doing it. I can't fathom doing it twice a day.
Oh, no, I don't. I've my whole life, I've brushed my teeth once a day.
But
But I actually have great teeth,
I
ironically.
forget.
That's what I'm saying. I can't forget. It's like when I wake up in the morning, my first thought is like, I don't want people to think my mouth stinks. Like, so like my first thought is like, I need to brush my teeth. I don't care if I shower.
I'm a nighttime brusher.
But, oh, I've never heard of such a person. You're a different breed than I've ever heard of.
Yeah.
I don't know if that's offensive
I
to
don't
you
know.
or anything. But
It's the last thing I do before I go to bed at night.
really?
Yeah.
Do you think that was how you were? Maybe I'm the
Well,
weirdo.
almost less.
Maybe I'm the weirdo. I don't know. But like, is that just how you were raised, or like? Because I know a lot of
I don't
people
really
raise their
know.
kids being like, it's bedtime, brush your teeth. But I mean, I think
You're
most kids
you're
brush
supposed to do it twice
a
a day.
Right? Yeah, I think most kids do it twice a day. I've never. I mean, maybe when I was a kid I did, but like me and my entire, I want to say, everything after braces, I've always brushed my teeth once a day.
See,
Morning,
I
that's
never-
it. And it was always the first thing I had to do when I wake up because I didn't want bitches to think I had smelly breath when I went to hit on them.
There was a time when I had bad breath a lot because your brother would yell at me, like, your breath stinks. And I'm like, okay. But usually it's not too bad. Or at least nobody ever says anything, but I check it myself.
What does
But-
that mean?
You can smell your own breath.
Right, but didn't you just say that you weren't noticing before? I'm just
I
trying
mean,
to
well,
follow.
I've
okay.
started to check it more, myself.
Okay, so since he said it, you started checking it. Okay.
That was a
okay,
good,
okay.
10 years ago.
Okay, I don't know. I was trying to follow the story there. All right.
But,
yeah.
yeah, it's just, I don't know. Sometimes I forget. I'll just go to bed and not even realize it. Or I'll just forget to do it.
Oh, I could never do that. I could never. I have to do it every morning.
See,
it
my
has to be every morning. I think I missed 2 from forgetting in the entire 20 years plus of being an adult, I think.
My problem is with routines. I can have a routine. I can do it every day. If I forget one day, I can just forget forever after that. You miss one day and it's gone out of my brain. It's like, what? I used to do that?
I feel like that's me with new things, but not me with things I'm already in routine for. So maybe you have to do it like at a, you know what I mean? Like
Right.
do it before you
I don't know.
hit that certain. I'm just thinking out loud. Like I'm just
Because I'm good at forgetting to cut my fingernails. I'll just
Oh,
forget.
I just don't care.
I'll forget for
I
days
just don't
on
care.
end.
I'll
know,
notice they're long and I'll be like, go fuck myself.
I'll
Like,
know I need to do it, and I'll look at them and I'll be like, okay, I'm gonna do it when I go home.
nah,
and then I just
don't
forget.
Do that. I'll just be like, I'll get to it someday. I
Toenails?
guess today's today.
My toenails are terrible because I hardly ever see my toenails.
I never cut my toenails. I maybe do it once a month.
I do once a month.
Nope, not even. I'd say once every 2 months, 3 months.
But like, I'll have these plans. Like, I gotta shower. I gotta do this, and I'll just forget all about it. And next thing I know, I'm going to bed, and I don't even realize
See,
it.
I can't, dude. Like,
It's
and
bad.
it's interesting too because your routine is very reversed from mine. Because like, I can't wake up. I have to wake up and take a shower every single day. I have to wake up and I have to take a shower. I've altered myself as an adult and learned some things, like meaning I started only washing my hair every other day because it's better for it or whatever they say. So like I'm changing myself in that way, but there's never been a day where I can't like. My routine has to be it. I have to wake up. I have to shower. If I don't shower, I don't really wake up. Grams. Then I have to get in the shower, and then when I get in the shower, I always have to brush my teeth after. I can't not brush my teeth after I get out of the shower. Sometimes I'll do it before, but I can't not brush my teeth after getting out of that shower. So it has to be done after the shower or before the shower, but somewhere in between the getting out of the shower, the teeth need to be brushed.
Right.
I don't feel right if I haven't brushed them.
See, I'm also a nighttime showerer too.
See, well, that's what I was saying. I can't start my day without that. So to be a nighttime shower just seems like a foreign language to me.
I can't get myself to wake up before I need to leave for work.
Oh, me either. But that dude, I used to call and be like, "Yeah, I'm on my way," and then get in the shower and then fucking take forever. They used to hate it. Like,
if I got to be to work at 6,
yeah,
I'll get up at like 5:40. 5:45.
I can't do that.
And I will.
If I do that by accident, I'll still have to shower. See, that's the
Yeah,
thing.
see,
like, I can wake up that late, but I'll call you and be like, "I'm on my way," and then get in the shower and then wait, and then you'll see me at 6:20 or 6 whatever.
I roll out of bed, throw on my work clothes.
I can't
and
do it.
Go out the door.
I feel so uncomfortable just hearing you say that. I can't do it. Like I just feel dirty. I feel dirty. I can't do it. It's like
I can't fathom waking up any earlier than I need to.
I agree with you. Like I wouldn't be able to do that either. And when I have to get up early, I still have to shower though. That's the thing. I just can't fathom going at like the day without washing myself from the day before and just getting it all off of me. Like
I shower more in the summer than I do in the winter. Because you sweat a lot more in the summer, so I shower more.
Facts.
In the winter, I can go longer without it because I'm like, okay, I'm fine. But yeah, just how it's been.
I just can't. I don't know. It's a weird feeling. And wow, how did we get here from dental care? So you were you brushed your teeth once a day.
We went way around.
Yeah,
but it explains the whole scenario of why I can forget to brush my teeth.
Oh right, you forget sometimes. That's how.
Because I just get lost. I mean, I forget to eat some days. I just go all day and I'm like, I never ate.
I've been there. See, that I can relate to. That I can very much relate to.
Forget basic.
And people give me shit about it. I'm like,
They're like, I forget to pee. And they're like, how?
Oh, dude, not for a whole day, right?
Well, no. Till my body starts screaming at me. I'm like, oh, wow, I gotta go.
I was going to say, that's what I always tell people. My body says it, I'll do it.
Right.
I mean that for hunger. I mean that for peeing. I mean that for whatever. Maybe I take an extended pee break, but if my body tells me, I do it. But, like, I don't ignore my body. So you can't tell me I'm doing anything wrong because I'm not ignoring my body.
Sometimes, though, it's not... I can't ignore my body. You get that first sign that says you have to pee, and then then you're fine. Then you can do the next time, and that's when you really gotta go.
Wait, what?
But... Yeah,
I don't skip the time. Is that what we're... Okay, I think that's where we're missing the link here.
There's an initial sign when
and then when it says it, I go, okay,
your body
I'll do
says,
it right now.
you gotta pee. But if you ignore that...
No, why would you do that? Don't ignore that!
Then it waits, and then when it gets to the
Have
other...
you never seen Liar Liar?
Then it gets to the other point, and then your body says urgently, you need to go.
No, that happens to me once every, like, 3 months, maybe.
But...
That's, like, a problem. You can't... if I wait that long, I'm peeing in a tree, and I might become a sex offender. I don't know. Like...
Then, this brings up the part of the tism, where...
What?
I just don't... I don't hear my body telling me that.
Why? What?
I don't know.
It's telling you.
No,
it said it. It's hey, Phil.
Doesn't even register until I'm like, my bladder's gonna explode. I need to go.
That's a problem, dude.
It is a problem.
That might actually be. I don't think it's tism. I think it's a physical. I think that's like a reverse. Like a reverse. What's that called? Reverse. Oh, what's that fucking thing called?
Because sometimes I know, and then I'm like, okay.
What's the poopy thing?
The poopy thing?
Yeah. It's like a reverse Crohn's disease. It's like, yeah.
See, from my research of the tism, it's just hard for you to understand your own body. What your body's telling you.
Everyone's tism is different. That's what makes it hard to research tism.
It does. But
It does, because like
that's-
everyone's gonna think what they research is like tism, but it's like, dude, it's not. It's
That's my
everyone's
thinking.
tism is different. It's called individuality. You know?
Because you go to the doctor and you tell them, okay, well, I have this pain or something, and they're like trying to get you to explain it more, and I'm just like, I don't know, it just hurts, and it's right here. And they try to get you to explain, and I'm like, I
does
don't.
that happen?
It
Like,
does all the time.
To you?
Yeah.
Oh.
And they're like, well, on a scale of 1 to 10, how bad
I
is
think
it?
you might have something that's different than what you think you have, or something.
And I'm like, I don't know the scale though, because
I
how?
mean, you don't know the scale. I don't. What?
Because I'm like, what if a 1 to me is like a 7 to somebody
this
else?
is like what I bitched at Paul about on the episode we were just listening to that we haven't released
Right,
yet.
the scale.
That was literally about the fact that like people's pain scales and things like that are on discomfort scales. Everyone's is different.
Yeah.
And I said that's why you got to look at it so much based on an individual that like I go, who makes that pain scale? Because everyone's scale is different. So who makes that pain scale?
Right.
And that's what I said. But like,
Because my pain scale is much lower than most. Very low pain threshold.
yeah.
But then I think I'm like, is it a 10? Have I ever experienced a 10? What would a 10 be?
And then it's like, what would a 10 be to you? What would a 10 be to me? You know?
Right.
It's
Well, I
like-
think of what would a 10 be to me, but then I'm like, I don't know.
No, I understand.
I've
Yeah.
never, as far as I know, I've never experienced a 10. So
That's the thing about a 10, though.
I imagine it to be like breaking
In
a
my
bone or something.
experience, you can experience a 10, but
There's something
I promise
worse.
you, 10's always never a 10. Like, there's always
Right, there's always something that could be worse.
No, there's always something that is worse. It's not could be worse.
Right.
There's always something that is worse. And that's honestly what I find very scientifically fascinating about pain is it is that mental. Like, there's also studies where like they show children and like how certain things are fear-based and the response is learned and things like that. Like they'll stab them with a needle. It's fucked up. But like they'll stab them with a needle with nothing in it, but like they don't even react. But you tell them they're getting a shot and they're like,
Right.
like,
If they know it's coming.
yeah, no, it's a shot. It's a fucking shot. And then they're
Right.
playing with blocks and you're like, and they're like, what?
Wait, what was that?
Wait, what was that? Wait.
So,
No, but that my point is that it's very different for everyone. It's very,
Yeah.
very individualized, And I think, like I've often found that I don't know what 10 is. That's what I have a high pain tolerance, from what I'm told by people giving me pain,
Yeah.
actually. And wow, that was a weird statement. But for example, people that tattoo me or people that have drained fluid from my knee, again, a weird statement. But like they usually look at me and they're like, well, that was weirdly easy. Like what?
right.
Why didn't you move? Are you okay? Like you, my tattoo artist, who's amazing, he once said to me, I talk about you to other people. I use you as an example, and I say, and then when I was tattooing your mom, what I said to her was, yeah, your son's amazing. He sits like a corpse. And then I felt really weird about saying that to your mom. And then I was like, that's awesome.
See, that's my problem. That's my problem with getting a tattoo.
What? Not the moving?
Well, no, like I have such a low tolerance for pain,
That you move a lot, or
and I'm like, well, I don't know.
they would tell you if you moved a lot?
Well, yeah, I haven't gotten one.
Oh right! Oh my God!
That's-
I
yeah,
forgot.
I-
I forgot. Okay, you
I
could've
haven't
said
gotten
that,
one.
you idiot.
Your brother's gonna
Everyone I know has tattoos, so it's weird that
I know.
Obviously, I forget that you don't.
Your brother's gonna give me my first
yeah,
one.
we heard.
Most
We
most
talked
likely,
about it. We already
probably.
know.
But I just don't know.
You're just a
I mean, I know enough that if it hurts, don't move.
my dad.
But-
I asked my dad before I got my tattoo, my first tattoo. I asked him what did it feel like, and he gave me a description that I think was very accurate. And I don't think I think I've given it to multiple people, and most people agree. But then I have had a couple people who disagree. But again, pain is so different to everyone. It's whatever. I felt this was very accurate, and I felt when I got a tattoo, I was like, damn, that's exactly what it feels like. So I'm glad he told me that. It's like someone scratching you. I don't know if scratching's the word he used, but like it's He might have said cutting. I don't think cutting's the appropriate word, but like
Right.
it's someone scratching you with a butter knife. That's what it feels like. They're actually cutting. I guess they're cutting you with a butter knife, but it's not like cutting you like I'm cutting myself. It's like
Right.
it's like they're dragging it on you.
Right. It's almost like a
until-
light. Just a.
I wouldn't say light though. That feels like the wrong word too. It's like that, but I think that the way he described it when he said it's like a butter knife. He probably said cutting, so I'm gonna go with cutting. But like he probably said it was like a butter knife cutting you, which I do feel is pretty accurate. But it's like a dull version of that. It's like a dull butter knife cutting you, which I feel like when I'm saying it out loud now sounds more brutal than it really
definitely
does.
makes it sound
But
worse.
like, it actually when it hit when the
But I get
when
what
the
you're
needle
saying.
hit me, I was like, oh, that's what it feels like. That is exactly what it feels like. What he described was exactly what it feels like.
I can picture what that feels like.
Right, exactly. And then when it hit me, I was like, that's what I thought when he said that.
Yeah.
Like, that's the best I can give you. But I also think it's important to mention that different parts of the body vastly hit differently. It
Oh
hurts
yes,
a lot
I know that.
differently.
I know that much.
That is very true. I can't wait to get my ribs tattooed because everyone's a bitch when they get their ribs tattooed. And I can't wait to like see if I actually, because like I said, my tattoo artist my whole life has told me I'm like a corpse. I don't feel
Right.
anything. And so like, to me, I'm like, all right, I want to get all the tattoos that people are like, don't do that. It hurts a lot. Like
Just to see-
Tom bitched so much when he got his back, and I was like, dude, it's your back.
Right.
Like, come on now. And then someone else said, no, backs hurt a lot. So I was like, all right, I'll give him that. But to me, I'm like, your back.
Right.
I don't think so. Chest, maybe. But Tom said all his tattoos hurt like fuck. And I was like, dude, you're a little bitch sometimes. Like, what is this?
Right.
And like, but I'll be straight up honest about mine. I enjoy getting tattooed. Like, I actually like the feeling. That's why the tattoo artist says the shit he does about me, because I like the feeling of getting
Right.
tattooed. I enjoy
Yeah, you're a
it.
rare breed then.
I'm a fucked up person, so like I like the feeling of getting tattooed, which is why I sit like a corpse. However, I'm real about this, and there are exceptions to this type of shit.
I would expect
And
there
I'll
to
tell
be.
you right now, in here, right here, where people can't see it, where the inside of
The inner elbow.
inner elbow, if you will.
There's a name for it, but I don't know.
Yeah, I
off the
know.
top of my head.
There's a term for it, but like where the forearm and the bicep kind of meet and they bend, that hurts. That shit hurts. It feels like it's tearing.
That's what I've heard.
It feels like a tear, and that shit hurts. I think that definitely hurts. I felt that. However, the other part I'll talk about is here, inside, in the inside of the bicep, deep, almost to the pit.
Yeah.
That hurt. My experience though was different than most people's, where it hurt a lot for like, honestly, like 30 seconds maybe. And after that 30 seconds, I think he hit a nerve unintentionally or something like that, because immediately it went numb. And
Huh.
I didn't feel it for the rest of that part.
Huh.
Isn't that crazy? Like
is
he
crazy.
he hurt, he was doing like, say, like right here. And I was like, oh. And then for like 30 seconds I was like, oh. And then all of a sudden I was like, oh. I don't feel anything. I don't feel anything anymore. It's just a shaking of my flab. You know what I mean? Like it was
Yeah.
like and I was like, what the fuck? That was a
That's
weird experience.
strange.
And I didn't tell him because I was like, I'd rather just not feel it and him get the artwork done. So like I didn't
Right.
say anything to him. But then after I was like looking into it, talking to people, and I was like, yeah, he definitely hit a nerve or something, I think is what it was called, a nerve. And then I just lost the feeling. And I guess that's a common experience for people getting tattooed in their armpit. So, cool story. And then, so those were my two painful spots. Everything else I've rather enjoyed, honestly. I've had people tell me that they got really painful parts right here. I didn't have that experience, but I also didn't get it. You see what I'm saying? Like,
Right,
I didn't
you
get it right
up
there.
to the wrist.
So, like, I can't say that I know,
Right.
but I could say that this didn't hurt. And, you know, anything around this wasn't painful. But, like, you know, people have told me directly on that vein hurts. I enjoyed the shit out of every time I got tattooed for a long time. It just felt so good. I'm some kind of fucked up person, but like
A little bit.
if you think about it, it makes sense because think about the endorphins and different things that are released when someone cuts themselves. It
Yeah.
releases something like
Right.
that, which is also why after you get tattooed, it kind of feels that sensation of stuff. And I love that feeling. I always got off on that feeling. That was like a thing for me. So like, I'm the perfect candidate. Like I'm the perfect corpse to be tattooed,
Right.
honestly. Which is pretty fun. I don't know why I like that about me, but I like it. People talked about me like I was cool, and I enjoyed it.
Everyone's different.
Yeah. Wow, I forgot how deep we got into this.
Yeah, we've gone
So about your dental
we've gone
care.
down the
So
street and
about
around
your
the corner a few
dental care.
times. So back to
Hold on, I gotta check something.
okay, make sure things are still.
Wow, we're 43 deep and we barely.
I know.
I haven't even told my
We
dentist.
haven't
So go ahead. Go ahead.
Gotten to the story.
Go ahead.
So bringing this to the most painful experience of my life.
Yeah.
So I never went to the dentist a lot growing up. I went a few times here and there, but my teeth were.
When you say growing up, so like, are you talking like before 14, say, or
I don't really know much before like
what do you mean you don't know?
I don't remember how often I went.
Most people don't remember before 3. What do you mean you don't remember before 14?
I just don't remember going to the dentist very often.
Okay.
So I don't think I went very often.
Barely, it's, it's a 2-time-a-year thing if you don't have
Right.
problems.
So I don't know. My teeth are fine. I didn't have cavities.
Are you sure? Because you didn't go to the dentist, so we don't know.
As far as I know, I think I may have had one when
We're
I
gonna
was
have
younger.
to talk to Trudy about this.
Maybe. She probably won't remember.
Go ahead.
She has a bag of my teeth still from when I was a child.
All right,
though.
that's fucked up.
That's
Go
really
ahead.
strange.
Go ahead. Just stop. Stop.
Anyway,
Trudy.
I should have had braces when I was younger because I think I have a bit of an overbite, and my teeth are a little crooked, but nothing bad. But it was one of those. It wasn't bad enough that like you need this, and they were too expensive for.
I get that.
So we just didn't do it.
Yeah.
Whatever. I'm fine.
That's why I have a hole in my mouth. My mom. So like they had to remove a tooth from my jaw, and there was no tooth under it, like for another tooth to come in, kind of thing. And so like they removed that. Hold on. Yeah, that's fine. That's why there's a big hole in my mouth because they were like, all right, and so to keep his teeth where they are, you need to get a bridge, and to put a bridge in between his teeth, it's going to cost you $5,000 for the original bridge and this much for the. And
Yeah.
she was like, "No, he's good.
Yeah.
Thanks.
It's stupid.
Bye."
Stupidly
Like-
expensive for stupid
Like,
things.
bye. He's fine. He'll
Yeah.
live with a hole in his mouth. He's fine. Thank
Yeah.
you." Yeah.
And so when I was in high school, my parents started bringing me to Salisbury Family Dental. You know, they were okay. I'd go there for checkups and cleanings every so often, whatever. Everything seemed fine. And then I turned 18. Was it 18 or 19? I just started working not too long before that. And they were like, oh, his wisdom teeth need to come out. So I was like, okay. I didn't know any. I was just like, okay. Just going to go with it. Parents went with it. And so they booked the appointment. I go in there. They didn't do anything but Novocaine. No laughing gas, nothing. Just Novocaine. And they put the first few shots in.
First
They,
few shots of Novocaine?
yeah.
How many were they? Were you getting all your wisdom teeth
All
out?
4.
Oh, Jesus.
All at the same time.
Damn, dude.
With just
Okay.
Novocaine. And I didn't know any better because I was just like, I guess this is what they do.
I mean, I don't know either. I don't know anything.
So I was like, okay.
So are they supposed to do like a combo of those things?
Well,
Or-
I mean, I think they could. I don't know.
So-
I still don't really know.
I felt like you were going in a
I think-
direction where they did something wrong,
Well,
but
I
I,
think a
don't
lo-
know what they did. Like,
a lot of people get like laughing gas or something.
and that or instead of that, because I feel like they get it instead of.
I think it's instead of. I don't really know.
Right.
But like I feel
Which
like
Novocaine should be better than laughing gas.
don't
Laughing
know.
gas was Nick's problem. Nick woke up during some of his surgeries because he was only on laughing gas. That's just not good.
Well, I mean, it's not supposed to put you out, really. I don't think so.
Yeah.
I thought it was just more of like a. It just kind of. You're like a twilight state, so you're like awake, but
I mean,
you're
that's if
not.
they don't give you enough.
See, I didn't know.
Yeah.
I've never had it, so I don't know.
I haven't had it, but I know a lot of people. I know at least 3 people that were addicted to it. Then I know what my brother went through.
Well, anyway, so they give me the Novocaine, and they start digging, and I'm like, this hurts a lot. So they give me more, and then they wait a little, and they start doing it again. I'm like, this still really hurts. So they more Novocaine. I lost count of how many they did throughout my mouth.
You lost count?
It was somewhere over 12. They
Dude.
pumped me full of Novocaine in my mouth.
That's a lot.
Maybe I don't remember, but
I'm not trying to make you doubt yourself. I'm just saying I'm blown away that that's such a
an excessive amount. And it got to the point where he was sitting on my lap, digging in my mouth to get my wisdom teeth out. It was traumatic.
That's disgusting.
For the most part, I blocked it out of my memory because it was such a traumatic experience. But I can just remember laying there in the chair. He's like on top of me, and I just feel just straight up digging at my teeth to get them to come out. And the worst part is, they didn't need to come out. Come to find out later on, like, it wasn't like these need to come out. They probably would have been fine if I had left them in there.
How do you know that?
Another dentist I saw or something like that.
So you're making me really you're supporting what I've been thinking about this whole time because I'm in the middle of procedures right now. Go ahead.
So after they finally got them all out and whatever, I left, went home to recover this and that. They fucked up the muscles in my jaw, so I couldn't even open my mouth. My mouth was stuck. So we had to call them the next day, and they had to prescribe me muscle relaxers to relax the muscles. And I went to work a couple days later.
Wait, how old were you again?
18. And I went to work a few days later, or whatever, and my coworker made me laugh, but my jaw hurt so much. He was like, "Oh my god, I'm so sorry. Didn't mean to make you laugh," but I'm trying not to laugh. I'm miserable. It was a week I couldn't open my mouth. I don't know how it ended up fixing itself, and I was fine, but
I probably needed that time to heal. But yeah,
it was just not good. I was like, I'm never going back there again. That was the worst experience of my life. So, after that, I didn't step foot in another dentist office for 18, probably a good almost 10 years.
Almost 10?
Because I think finally, I tried going to the dentist, I think it was 2018, 2019. Somewhere around there. I tried going back. I went to this place in Hale. It was Dr. Dental or whatever.
That's weird you went to Hale. Yeah.
I don't know why, but it was just...
Maybe it was the best Googled.
I found a place, and I think I was having pain or something. And so I tried to make an appointment there. And, I sat down in the chair. They went to put the shot of Novocaine in. Worst panic attack of my life. I had to leave. They hooked me up to the monitor and thought I was not okay. And I was like, we can't do this. No, I can't do this. So I just didn't go again for another 2 or 3 years. And then I was really having a pain because I had gingivitis, whatever, I was having some sort of infection or something going on. It was hurting. So I found this place in Newburyport. They're an artesian dentist, but
what does that mean?
They do a lot of the cosmetic stuff too. That's
what that means?
Yeah, they don't. They'll make your teeth, whatever.
Pretty?
Yeah, they'll give you weird custom requests or whatever.
Yeah.
But I found them because they do sedation, and I was like, I think that's what I need.
Sedation?
Yeah. So I went there. They did an exam. They told me, okay, what's going on? I needed a scaling and a root planing, which they gotta cut under the gums, and to get all the tartar and plaque and all that stuff out of there. But they gave me Valium for it. And so I finally, I make the appointment, I go there. They give me a half of one, and then they waited 30 minutes to give me another half of one, or whatever. And then, so they come in and they ask me, how I'm doing. I got like...
So they gave you another Valium and what?
Oh, okay. So they gave me the half of a Valium, and then they waited a little while, then they gave me the other half. Then they waited. Then they came in. I had like a weighted blanket on. I had my headphones.
Weighted blanket on?
Yeah, they had weighted blankets. I love a weighted blanket so much.
Yeah, that's very autistic of you, but like...
And I had my headphones on. I was listening to music, And they came in. They asked me if, okay, you ready to go? I was like, you guys can do whatever you want. Let's go. Afterwards, I was like, I can understand why people get so addicted to this. I feel so great right now. I
think that's what Dr. House was addicted
It was
to.
amazingly terrifying, because I think they did half of my mouth, and then they did the other half another time.
Like,
it was,
half up and down?
I don't know if it was half up and down or half side
right,
to side.
yeah.
I think it was up. They did the upper and then the lower.
Okay.
I think. I can't remember. But, they did that. I need to have a ride home because I can't drive.
Not on Valium.
And then I was living in Derry at the time, so I just stayed at my parents' house, slept on their couch, and it was great. I didn't feel a thing. The only thing that sucks is insurance won't pay for the sedation because it's not medically necessary.
What?
So I had to pay $300.
I mean, that's not bad for sedation.
I was like, on top of whatever I had to pay out of pocket,
Oh, that's unfortunate.
which was it was steep, but I was like, honestly, if it means I can actually
feel your
get my
mouth okay?
Yeah.
Yeah.
And their goal is like, they'll start you on that, and their goal is to wean you off of it so you don't need sedation for every appointment.
That's weird.
Which, I don't know how they do it, but it worked. Because, like, the first two...
I'm shocked to hear... Okay, go ahead.
First two, they did both those deep cleanings, and they did that with sedation. And then I went back for just a checkup cleaning thing that without anything, it was fine.
Right.
And then I had another deep cleaning, and they gave me sedation again. But I only did it 3 times, and that was it.
When you say you did it 3 times, does that mean they gave you sedation for 3 times?
Yeah.
And you had more deep cleanings than that, or just more cleanings?
I've had more. I've had
I'm just
regular cleanings, which is regular Novocaine now, and it's fine.
Okay.
The dentist there, I don't know how he does the Novocaine, but I don't feel it. It's fine. It doesn't like hurt like it, I don't know. The first
like the shot doesn't hurt,
right.
Or like okay.
I don't even really feel it. He just
Interesting.
And it's done. The first time when I got my wisdom teeth out, the guy hit a nerve putting one of them in. I almost wanted to punch him because it hurt so much. But yeah, no, and then it sucks because I had the dental hygienist. She's been the same one since I've been there. So I knew how she worked, and she knew how I worked. So it was fine. But the last time I went, I got someone else because I don't think she works there anymore. And I was devastated. I get very set in my people. Like, I have my barber set, and if he ever stops cutting hair, I don't know what I'm going to do. Because I can't just go see a new person. And so I've been doing that. So eventually they started, I had some, like, holes in the front of my teeth from, like, it eating away at the enamel, the build-up or whatever. So they started doing fillings and getting that and making my teeth look a lot better. Because some of the, especially right up in here, when they do the cleanings, it hurts quite a bit. But I can usually just kind of make it through it. If I haven't been for a while, it hurts a lot more. Which I stopped going, was it last year? It might have been even almost 2024 now. I stopped going because they were really good about my payments. I just pay them whatever I could when I went. So after every appointment, I'd give them a lump sum of a few $100s. It wasn't much, but it's what I could do. But I got to the point where I owed them like a couple grand. So they were like, unfortunately, this is where we're going to need more money from you before we can continue. I'm like, I mean, I can respect it. You guys have been cool with me, so okay, but it's going to
Did
be...
you ever pay them?
I have been, slowly.
Oh, you still haven't finished though?
I still owe them $600,
Woof.
which, now that I got my tax return back, and for once I actually got money back, because I changed my withholding status so to get money back, I was like, okay, I'm going to pay them, and I'm going to... Because we were mid doing all the fillings, too, when I stopped going.
Mm.
But now I've got a lot of the build-up again. Because once it starts building up, you can't get rid of it on your own. It's just there. They have to scrape it off.
Yeah.
And it's been so long. I did go see them probably 6 months ago, maybe almost 10 months ago now. I went to see them because I think I was getting an infection up there. And I was. They gave me some antibiotics and gone, whatever. But it's rough.
Yeah.
Something else is going to add to that, too.
What was it?
I have periodontal disease,
What was that
which
mean?
is just like... I used to know what it was. It's just like eating away
You know
at...
you have it. You don't know
It's
what it is.
it eats away at the gums. It eats away at the
What
enamel
eats
in my
away?
teeth. Just like the tartar buildup and the bacteria. I can give
Now,
you...
is that something that's caused by the
It's...
buildup, or is that like genetic, or is that like?
I want to
it's-
say... Hold on. It's caused by just the plaque buildup. Because I was never great at brushing. I would brush them all the time, but I wasn't
Well,
the
you
best.
forgot. You already told
And I
us
do
you
forg-
forget.
I do forget. But it's a serious chronic bacterial infection that destroys the gums, ligaments, and bones supporting the teeth. It starts out as gingivitis, and then it goes to
yeah,
irreversible...
Isn't that like the thing that everyone's like afraid of? Getting
Right.
Or whatever? Yeah.
Because you start with gingivitis, and then when gingivitis gets bad enough, it turns into this, which is non-reversible.
Oh, interesting. So it becomes non-reversible.
Right.
Oof.
The gums begin to pull away from the teeth, and then forms pockets that are infected. I don't think it's quite, that bad.
Sounds like it's bad.
I mean, my gums bleed every time I brush my
Maybe you
teeth.
should look at this like more important.
Like
You seem
I,
like you're not looking at it
Oh,
very
no, I am.
seriously, sir. And
I
let me tell you,
have.
catfishing is a crime.
I have, because like
Catfishing is a crime.
I have noticed my gums have receded, especially in certain parts, especially up here, in the top right,
Mm-hmm.
and my gums bleed all the time.
Oh, that's not good. I've been told that's not good.
No, it's not good. Even when I'm eating food, sometimes they start bleeding.
That's not good.
No, it's not.
See, I have worries about mine, but my worries are much smaller than your worries.
And every time I go, the dentist tells me, he goes, you got to brush. I know it's gonna bleed, but you have to brush because you got to get it all out of there. I'm like,
Sounds
yes,
to me like you're not brushing your teeth enough.
I do. Well, I should be doing it more than once a day,
Apparently,
but
I feel like
I don't.
this is one of those things where everyone's different. Like
And-
I apparently can get away with brushing my teeth once a day.
Now
But I think you need to brush them twice a day.
the problem is sensory issues with that. Brushing my teeth is.
Get over it.
I can't use a manual toothbrush.
What?
I
What does
can't,
that mean?
The feeling of me scraping my own teeth bothers my soul. Ugh.
Fuck your soul.
I can't.
Just stick the goddamn
no,
thing.
I cannot do that.
You can put a penis in your mouth, but you can't put a goddamn
Exactly.
toothbrush.
Yes. I have to use an
I'm
electric.
sorry, I can't.
I have to use an electric toothbrush, and it has to be medium.
Okay, so use an
I
electric.
do. That's what I use every day.
What?
But
What are we talking about right now?
it's still a lot.
What is?
The sensory overload of brushing teeth. You don't understand,
I don't.
and you're not going to.
I
but
don't. And I will not pretend to.
It's it's hard.
I've met people with sensory issues. And let me tell you, there's always ways around them.
I keep seeing advertised this special toothbrush on Instagram all the time.
Don't fall for that kind of shit.
But no, not in place of what I already do, but something for the other time of the day that I should.
What?
It's one of those like
Okay, you're gonna have to just tell me what it is now. Like,
it's like one of those toothbrushes that it's got bristles all the way around, so it kind of it's almost like a mouth guard. You just bite down on it and you kind
I
of
think that's kind of cool.
It vibrates and you move it
Sounds
around.
nice.
And I've been thinking about that I could do it at breakfast, like after I eat breakfast and then after I eat lunch. Do that and then do an actual brushing at the end of the day with the real toothbrush.
I'm confused. Does this thing not? It sounds like it brushes your teeth better than your toothbrush.
See, that's where I'm skeptical. They say it does, but I'm like, does it though?
I mean, it sounds like it. I don't know what it. I guess I have to see the product, but like,
it sounds like it does.
It does.
But in my limited research, people are skeptical. I'm skeptical.
You're making me skeptical.
If I can spell it right. The best U-shaped electric toothbrush for 30-second full mouth cleaning. That's what it looks like.
That's how you described it.
And get out of here.
Can we see it in action?
That's proof it works.
Yeah, I was gonna say, yeah, proof it works. So far, I feel like this is just a dumb scam.
See, that's my...
That might be cool. Might be a cool scam. The fuck am I looking at? What are these stats?
I don't know.
The fuck? I see a lot of numbers not telling me shit.
It says...
I hate that. That's the number one red flag.
Overall results...
Of what?
It's up to 10.3 times better on hard-to-reach surfaces than a regular toothbrush. Up to 6.9 times better clean across the whole mouth. Up to 13 times more plaque removal in hard-to-reach places than an electric toothbrush. But I'm like, I don't see...
Those stats feel very...
26.6 times better than a whole mouth clean in 1/4 the time versus a manual toothbrush.
Say that one more time.
Up to 26.6 times better whole mouth clean in 1/4 the time versus a manual toothbrush.
Fake.
That's why I'm like, can I just like find a video?
Did you read the reviews?
I have, and some people say it's great, and then some people are like, meh, it's not all it's cracked up to be.
Did anyone say it was bad?
Not that I've seen yet.
I'm gonna go with it's probably not bad then. I think that might be worth a shot. To be quite honest. If not a person says it's bad, you got some mediocre reviews, but some good reviews. To me, that sounds like a score.
I actually want to find like their advertisement video, but
It sounds like it's not worth it because that will probably lessen the trust I have in them. I'm sorry, what the hell was that?
I don't even know.
What the hell was that noise?
Don't even want to know.
What?
I don't know what I found, but I found something. Because they make one for adults and one for kids.
Are you serious?
I mean...
What? That's weird.
Why? Of course they do.
Don't sell to children if I can't even trust your product.
And they have like this foam toothpaste they use for it.
What?
Yeah. It's like a weird foam toothpaste.
I can't hear what they're saying.
Well, there was music, so I didn't want to...
It comes with the auto brush holder. So this is the one for kids. This is the lion design. They have different designs. They have the...
Yeah, well...
What the hell is happening?
I hit the...
Oh, sweet Jesus.
Listen, this is Instagram, and I can't...
What, you can't control it?
No. You can only hit play and pause. Or I can restart the video from the beginning. It's not YouTube. Okay?
People can't see me, but my eyes would say my truth.
Ask a hygienist. Here's a dentist review.
This is the best.
I don't trust them.
This is...
I know that.
Katranji and Nemeth.
Yes, yeah, I was going to say.
I'm a periodontist in Southfield, Michigan, and I want to talk to you a little bit about a new toothbrush that we tested. It's called the Auto Brush, We tested an earlier version of it, which is right here, and we found that it was somewhat limiting. The bristles were a little bit stiff. My own feeling was it could use some improvement. And so they did make some improvement, and this is the new model here, which has actual bristles as opposed to kind of a rubberized material. So I think it does a better job than the original. I'm quite sure it does a better job, actually. I did use it, I tested it out, and Skylar, who is here with me doing this video, he tested it out too. So they say that you can actually clean your teeth in 30 seconds with this, although they have 3 settings. It can be 30, 60, or 90 seconds. There's the everyday cleaning, the deep cleaning, and then the massage setting. So I tested it out. I used it for more than 30 seconds. I probably used it for 60. I didn't really time it, but it was definitely over 30 seconds. And I put this closing solution on my mouth, which is a red dye that dyes any film or plaque that may be on your teeth.
Also causes
and then
cancer.
After I brushed my teeth with this, I rinsed out again with the dye, because sometimes it looks really good after you brush, but then you have to re-dye your teeth, and then you'll really see if there's anything left over. By the way, you can also change the color of the lighting on this. It's got a lot of different settings, which make it interesting. I haven't seen any other
Got some
toothbrushes
RGB
with this
LEDs.
design. So it does have an interesting design. One possible problem is I think you get a couple of different tray sizes with this, but everybody has a different sized mouth, and these tray sizes, one of them may be perfect for you, but maybe not. So it could be really useful for kids who don't like brushing their teeth, or people with disabilities, because really it doesn't require much effort on your part. You put it in your mouth and you just gently move it around, and it scrubs and it cleans, whether it's really quite as thorough as other brushes. Difficult to say. It's pretty good, and it has its points because you can have different light settings. Some of the areas between the teeth are not as easily reached as you might think. And if you were to use this, you would use it in combination with a water pick and either floss or one of the picks that clean between the teeth. So that's the auto brush. It's very interesting. At any rate, make sure you keep your mouth clean, because if your mouth's not healthy, you can't be as healthy as you could be.
That guy felt so fucking fake.
Yeah,
And
just a little
so
bit.
fucking paid, and
That's the other thing is, do you floss?
not on a regular basis. I do floss when I feel the need, and I don't use regular floss ever. I use floss picks,
Right.
and I will,
Or you can't floss.
and then, but I
Flossing
do
is
it. And
out of the question.
Why?
The feeling of it going between my teeth, nope. Especially because some of my teeth are a little like
I think it feels good.
together, so I have to like push it in.
No, I have a couple where it's real hard, and I don't like that. But
I do not like it, and I don't like it when it hits the gum in
but
between
I'm
my
still
teeth.
willing to do it, even though it's hard to
I
get.
just can't do it.
Okay.
The only time it ever gets done is when the dentist does it for me.
So-
I just can't.
why?
Sensory issues bothers me.
What if someone like? What if your mom held you down and did it to you?
I would just be traumatized then. Probably not.
I was gonna say, wouldn't you just be able to
Somebody else can do it to me. I
Right.
can't do it to
That's what
myself.
that's why I was asking. It's like,
Because the dentist can do it and it's fine. But I just can't do it to myself. I don't know why.
that's.
I have one of those water flossers.
My wife just bought one of those.
Well,
specifically.
I bought one
for some
like
reason.
5 years ago. Never touched it. It was like one of those table ones that goes on the sink with a little tank and everything. But I didn't want to leave it on my sink because that's where my dad smokes weed, and the sink gets gross. So I don't want that getting gross.
Ow.
My toothbrush lives in my room with me,
It's like you live in a dorm.
pretty much. I mean, I live in my parents' apartment. My room is all my space. But I have a portable handheld one that I use. But it's complicated.
Why?
Well, I mean, it sprays everywhere. Like, it's best if I do it in the shower, because then I can just shower afterwards and spray the wall down.
What? What are we talking about right now? Because I thought we were talking about...
Water flossers.
Right, that's
They
what I thought we were...
I mean...
What? Why? What?
They
What is getting on the wall?
I mean,
Why
the water
is there
splash.
so
The water
much,
splash
what is
out.
happening right now?
Water splash.
My wife
out.
uses it in the sink, and I haven't seen much issues. So, like...
I don't know. I have
Are
maybe
you-
maybe it's just
what-
me. Maybe it's user error.
Maybe you just...
Well, it's like I can't.
I'm just trying to figure out
I can't
where the
see what I'm
wall-
doing with my mouth
Why
closed.
is the wall in the
Yeah, but-
shots fired? Like...
I can't see what I'm doing with my mouth closed.
I'm sorry, what?
If my mouth is
You can't
closed,
see what you're doing.
I
with
can't
your
see where I'm
mouth
aiming
closed.
if my mouth is closed.
Well, if your eyes are open,
Yeah, but if my mouth is closed, how am I going to see inside my mouth?
look in it.
Yeah, but if I open my mouth, then it starts spraying water out.
There's a mirror, and then what? I mean,
Yeah.
I've never used one, so
Well, I mean, I don't know if mine. I just use the more powerful setting, maybe.
Oh.
But it'll spray out because
Oh.
it bounces off your teeth and sprays water around.
Interesting.
And I don't want to get it all over the sink, all over the cabinet. I'd rather do it in the shower, but we don't have a mirror in the shower.
Put a mirror in the shower.
I mean, yeah, I was going to, but I haven't. But I need to use it because that'll help destroy the buildup before it builds up.
That's ideal.
But my life is one big complicated mess of teeth.
Sounds like your life is one big complicated self-induced autism session.
Mostly.
Yeah.
You're not wrong there.
That's what I got from that. That's what I got from that. A lot of, why can't you? Well, it don't feel right.
Yeah,
That was what I got.
it bothers my soul. I can't do it.
Like, I've never heard someone use it bothers my soul. And that, I just, yep.
I use that for a lot of things. A lot of foods that I can't eat.
That
They're like, why
tells
can't you
me
eat that? I'm like, because it
a
bothers my
lot
soul.
About you. Do you ever feel that as a reverend that Jesus ever gets in the way of your
No.
selfish diet?
There is zero Jesus inside of me.
Oh. As a reverend, that's hard to swallow.
This is much easier things
Whoa.
to swallow.
Dude's like, that it was way easier to swallow than you think.
Bingo.
Fucking nut job over.
So, now that I've explained my entire life story of autism,
Autism.
now it's your turn.
Oh wow. You did that for almost an episode and a half of material.
See? Stay tuned for part 2 where he explains his problem.
Apparently.
My problem was an entire episode.
And a half. we're at 1 hour and 30 minutes.
Well,
yeah.
I guess our first episode could just be about pain and pain and tattoos.
True.
Second episode is
But it won't be.
autism.
Autism is a good title, though. I'll give you that.
That's great.
It'll have to be titled by you, though. I can't say that or I'll get in trouble.
Right. Well, yeah, I know.
It was a joke. I don't care if I get in trouble.
Oh, thank you.